Hey guys, so looks like I'm doing a second video right now. Um, there's something on my mind and I don't feel justified in not sharing it. Um, so those of you who watch my YouTube channel and watch my videos know my background is in biotech. I have 2 science degrees. I I'm looking at a lot of what's going on with the coronavirus and a lot of what the CDC and other places are doing, and something really disturbs me about it. Um, they should have been collecting numbers a long time ago to find out what the infection rate is, find out what the spread rate is. And that way we could find out what the actual mortality rate is. I mean, granted, a lot of the stuff takes a bit a lot of the tests, they took a bit to get on the market, they took a bit to get everything together. But honestly, it shouldn't have taken this long. Now, maybe there's something I'm missing. Maybe there's something that I don't quite understand. As Milton Friedman pointed out, there's no human being in the world with enough knowledge to make a number 2 pencil. Science is a very complex industry. It's a very complex endeavor. There's a lot that goes on. But from the perspective that I have and from what I know, it doesn't seem like it should have taken them this long to start doing the studies. They should have been out doing antibody studies right along. They should have been out doing nasal swab studies right along. South Korea had tests practically right away on the market when all of this started. And okay, maybe it takes a little bit to look at those tests and say, okay, we can prove that these actually do work to the standard that we might see here in the United States, that we might see from the CDC and the FDA. But that shouldn't have taken months. That should have been done pretty quickly in a laboratory saying, okay, yeah, these tests work. They detect the coronavirus to within an acceptable range of error, within an acceptable margin of error. Okay. And then they should have been, do that. But then go out and start testing people. Start doing random sampling and finding out, hey, this percentage of people in California have already been exposed to the coronavirus. This percentage of people have it now. This percentage of people in Minnesota have it. This percentage of people across the United States, have had it and have antibodies to it. So there's a lot of research that I think should have been done and should have been done quickly, especially if you're going to say, okay, we're going to turn off the economy and force everybody to stay in their homes. So and take jobs away from millions and millions of people. I mean, don't get me wrong. Like, if there is a true plague, that's going to kill 10% of the population, or 80% of the population, or some crazy number, or even if it's 1 or 2%, as some people thought the coronavirus might be. Okay, maybe we need to make a policy around that. Maybe there are appropriate measures that need to be taken into play. But if you're going to do that, then you need to do the studies. You need to start basically right away trying to understand this virus. You need to start basically right away finding out, okay, what number of people out there are going to become sick because of this? How many people are going to be asymptomatic versus symptomatic? How many people are going to have serious symptoms? And how many people are going to die from this? How many people are going to have permanent injury from this? So there's a lot that should have been done. I mean, for crying out loud, we've had germ theory and modern medicine for quite a long time now. A lot of this stuff was there. And I wasn't planning on sharing this in this video, but I helped to put a molecular biology lab together in about a week. And we were going to we're going to be doing RNA studies to find out, okay, how many people currently have the virus, and we were looking into doing antibody tests to find out how many people previously had the virus and are now immune to it. And I don't want to give too many details about that right now, because I want to keep my public profile and my private life somewhat separate. But I'm somebody with a bachelor's who did that in about a week, with about $20,000 in the budget. And granted, that wasn't my money, that was other people's money, but why could the CDC not do the same? With millions of dollars. I mean, the whole point of it is the Center for Disease Control. That's the whole, what's even the point of the CDC existing if they're not going to do their job? Now, granted, maybe I'm willing to change my mind. Maybe I'm being too harsh. Maybe there was a compelling reason why some of these things couldn't have been brought together right away. Maybe there was some extended testing that needed to be done, or extended research that needed to be done just to make sure the tests were okay. Okay. But then why was it the case that these tests were available in South Korea? Why was it that there were about, 5 tests on the market right away in South Korea? Something's not adding up here. And I think the American people are owed a lot of answers. The government definitely owes me an answer as an individual. So, anyway, that's what I have to say about that. I don't know what the answers to a lot of these are. I don't know if it was incompetence, laziness, or if there was some reasonable explanation. Or if it was just plain evil. But honestly, I want to know. They owe us an explanation. But thanks for watching this video. This is Greg, out.